Every parent wants to keep their baby safe. I don't want to scare you, but some babies are at a higher risk of something called sudden infant death syndrome. Sudden infant death syndrome is when a baby dies in their sleep, and after an autopsy, doctors don't know why. Sadly, Black babies in the United States have sudden infant death syndrome rates that are much higher than white or Hispanic babies. For example, for every 100,000 live births, about 73 Black infants die from sudden infant death syndrome compared to 40 white infants. Why are more Black babies dying from sudden infant death syndrome? Research has suggested more than a few reasons why Black babies have a higher risk of sudden infant death syndrome. First, sleep position. Doctors say babies should sleep on their backs, but not everyone follows this rule due to culture norms. Studies show that Black parents are less likely to follow this guideline compared to other groups. Bed sharing is another factor. While infants should share the same room with parents, for at least 6 months, they should never sleep on an adult bed. Some families sleep with their baby in the same bed because they don't have a crib or want to be close. But this can be risky because a baby can get trapped under blankets or next to a parent. Studies show that Black parents bed share more often than other racial groups. Smoking also plays a role. If someone smokes around a baby, it can make it harder for them to breathe. Black families are more likely to live in places where smoking is common, and exposure to smoke increases the risk of sudden infant death syndrome. For example, apartment living might expose your infant to secondhand smoke if your neighbor smokes out on the porch and you leave your windows open. Never place a pillow in a crib. Not enough safe sleep resources is another issue. Cribs and bassinets can be purchased online for less than $100. However, some families don't have cribs or bassinets, and without them, it's harder to follow safe sleep rules. Programs that provide safe sleep spaces exist, but are not always accessible to families who need them most. Ask the hospital social worker for help if you don't have a bassinet for your infant. Lastly, lack of enough information about the sudden infant death syndrome. Let's be honest, not all parents get the same advice from the healthcare staff. Research has shown that Black parents often receive less information about safe sleep from healthcare providers compared to white parents. Knowing the rules isn't enough. Many Black parents already know the safe sleep rules, but that doesn't mean it's easy to follow them, especially when their parents shared a bed with them and they survived without sudden infant death. Just knowing the risks doesn't always lead to change. Research shows that Hispanic families have much lower sudden infant death rates, even though they may have fewer resources than Black families. One reason is that they are more likely to follow safe sleep guidelines, such as placing babies on their backs, breastfeeding, and avoiding bed sharing. How can we keep Black babies safe? Here are some things that can help lower the risk of sudden infant death syndrome. First, give every baby a safe place to sleep and never place an infant on their stomach for sleep. There are programs that give free or low-cost cribs and bassinets to families who need them. Ask the social worker who will ask you if you have everything you need for the baby. Say no if you don't have a bassinet to go in your room so you can get assistance. More of these programs should be available to help parents create a safe sleep space. In New Zealand, a special baby bed called the Pepipod R was given to 16,500 families, and SIDS deaths in the Maori population dropped by 29% from 2009 to 2015. Teach safe sleep in a way that makes sense. When Black parents get advice from people they trust, like other Black parents, community leaders, or Black doctors, they are more likely to listen. More programs should be led by people from the Black community to ensure messages are clear and helpful. Better health care for Black families. Doctors and nurses should make sure all parents get the same advice and help, no matter their race or how much money they have. A discharge video might be best to give the same message every time. Hospitals should also give out free safe sleep items to new parents, as this has been shown to improve safe sleep habits. Support families with social services from the hospital social worker. If families have stable homes, jobs, and enough money, they can make safer choices for their babies. Policies that help parents get time off work, find good housing, and afford baby supplies can help keep babies safe. What can you do? We all have a role in keeping babies safe. If you're a parent, make sure your baby sleeps on their back in a crib or bassinet without pillows or blankets. If you know someone who is having a baby, share this information with them. Help them purchase a bassinet and encourage a pacifier after breastfeeding is established. If you work in healthcare or the community, push for more resources to help Black families. Sudden infant death syndrome doesn't have to keep hurting Black families more than others. By working together, we can make sure every baby has a safe and healthy start in life.